And good evening, everyone. My name is John Nelson, and I am with the communications team at Vassar Brothers Medical Center. And I am so happy that you could join us this evening for a conversation about vaccines and COVID-19 and how they are impacting you, how they are impacting our community, and what we can do to encourage our friends, our neighbors, our families to get vaccinated. And so we're joined by this wonderful panel, and I am going to turn it over to Dr. Mrna Ayers now, who's going to moderate the discussion. And please, if you have questions during the event, feel free to post one in the Q&A or in the chat, and we'll try to get it answered. And you could also watch on Facebook and make a comment there, and we will try to help you out. So thanks very much, Dr. Mrna Ayers. It's all yours.
All right. Thanks, John. And thanks, everybody, for joining us tonight on this very important conversation about COVID vaccines and vaccine hesitancy and readiness, actually. And I'm so very, very excited to be joined by this panel of wonderful, wonderful people, colleagues and friends from within Vassar Brothers Medical Center, Nuvance Health, and also from the community and city of Poughkeepsie. I will tell you a little bit about myself and how I came to this work, and then we'll go around and have the panel introduce themselves with a quick 30-second blurb about why you're here and where you're representing, all right? So my name is Dr. Mrna Ayers, as John said. I've been a physician with Nuvance Health for about 12 years. I am based at Vassar Brothers Medical Center, so I've been working in the city of Poughkeepsie for those 12 years. And over that time, I've come to make a lot of connections within the hospital network and also within the community. And I can tell you that when COVID first hit, and to see the devastation that was being wrought, particularly on Black and Brown people who, when hospitalized, have a higher chance of dying than other populations. So when the vaccine became available, I actually anticipated this conversation months ahead, and the fact that we weren't going to see Black and Brown folks lining up in droves to get vaccinated for a myriad of reasons, right? But tonight we want to talk about, we want to explore some of those reasons, some of those barriers, and really discuss why it's important, why we should be getting vaccinated, and encouraging others to get vaccinated as well. So I'm going to turn it over now to Ms. Ozzie Williams, who is representative community advocate from the city of Poughkeepsie. Ozzie?
Good evening, everyone. Like Dr. Ayers said, my name is Ozzie. I reside in the city of Poughkeepsie, have been around here for 40 years or more, 10 years with our WIC program known as the WIC Lady. Later on, known as, you mean that diabetes lady? Yes, that's Ozzie. But also just being part of a community that always cared about the people in the community. So I started my journey when it came to being vaccinated. I had friends in Louisiana, Texas, Georgia. Did you get the vaccine? How was it for you? So I felt comfortable getting the vaccine because I had friends who had gotten it and were happy to have received it. And when our time came along in Poughkeepsie, I was very happy to receive the vaccine.
Absolutely. Thank you. Tiffany Dela Cruz.
Hi, my name is Tiffany Dela Cruz. I live in Beacon with my daughter. She's 6 years old. I've been with Nuvance Health for about 5 years, and I've worked at Vassar for about 2.5 years as patient liaison in our patient experience department. For me, getting vaccinated was a no-brainer. I was absolutely going to do it. After seeing all the devastation across the world, and how this horrible disease had affected so many people. Once there was a vaccine ready, I trusted that the people who I worked with, who looked like me or had similar names to me, that they were getting vaccinated. I trusted that it was the right thing for me as well. And I'm happy to be a part of this conversation. Thank you so much.
Thank you. Beth Hanson Hall.
Good evening, everyone. My name is Seth Hanson Hall. I live in the wonderfully diverse city of Newburgh, New York, and I am honored to be a part of the Vassar Brothers Medical Center community for the past 20 years. I serve in the capacity of emergency department supervisor, and I am truly grateful to be healthy and present on this panel this evening, as well as vaccinated.
Thank you. Dr. Olivia Santiago Ravado.
Hi, I am an emergency physician, and I am also the medical director for the emergency department of Vassar Brothers Medical Center. I've been residing in this community. I live in LaGrange. My children are in the Arlington School District, and we've been here about a year and a half, and I've been working at Vassar about a year and a half, part of the New Vance community as well. So I also represent the Latina community. I am originally from Puerto Rico, from San Juan, and moved to New England when I was 12. So I feel connected to, this area. Been in New York now for medical school, and I really relate to my community. So from that angle, I think it's so important that my community be protected because I live here, and from that angle, again, I'm very excited to be part of this panel so that we can get our community on the road to being and staying healthy.
Thank you. Dr. Valerie Cluzet.
Hi. So I'm one of the infectious disease physicians for New Vance, but based primarily at Vassar, and I've been part of the Vassar community for about 4 years, and it's been wonderful. As an infectious disease physician, people are probably like, oh yeah, of course she's gonna, believe in vaccines, and I do. It's one of the reasons I went into infectious diseases, because I think we can do a little bit for a lot of people and really save lives. So it's one of the things that drew me to infectious diseases. But I will say I'm also the kind of person that's not just going to do something without the science behind it. And so one of the main things for me with these vaccines was making sure that the whole process of their development and the study of them and their efficacy and safety was done correctly. And I feel really confident about that. And I feel like we're very lucky to have three options of vaccines that work really well, and hopefully bring us to the light at the end of the tunnel of this very, very difficult year.
Absolutely. And we have Joash Ward. We may have lost a video. I don't know if you can hear us still, Joash.
Yeah, I'm here, just having some technical difficulties there. Thank you so much for having me, John and Dr. Ayers. I was born and raised in the city of Poughkeepsie. It is my home. I am interested in the community actually being safe and being able to sort so much of the competing information that's been coming our way over the past year. I know a lot of folks have been concerned because first we didn't know enough about this virus, and now we know enough about this virus to keep us safe and to take the steps that can end this pandemic is something I'm interested in. And so I'm happy to be here.
All right, great. So now that we've all introduced ourselves and we've talked a little bit about why we've either gotten vaccinated or we're ready to be vaccinated, I want to ask the questions to the panel, and we'll start with you, Tiffany, if that's okay. What what would you say to someone if they were to ask you, what is the message that we give to people when they say, why, they ask, why is it important for me to be vaccinated? Or you made your choice, so why is it important for me to be vaccinated?
I think it's a message to the community that it's kind of like, mask wearing, like, I care about you. I want to protect myself. I want to protect you as well. So the more people that get vaccinated, the safer we are as a humanity against this terrible disease.
Right, absolutely. Ozzy, I know that you have a lot of community connections and deep roots, over 40 years worth of roots, right, in this community. What is your message to your community? Why it's important?
I think it's important because for some of us, it may be a lot easier to treat than prevent the complications associated with COVID if they become very ill. I know for a fact that within our own community, we have seen a lot of loss because so many of our members and community members had underlying medical conditions like diabetes, high blood pressure, heart conditions, respiratory. So I think for me, it's important that we get the message out to protect ourselves, to protect others. And I like life. I want to live and I want to be able to do things. And I think most people do like life and want to be engaged with others in the community. So for me, it's about life and living a life without medical conditions and problems associated with COVID.
Thank you. Joash, you are probably our only millennial on this call at the ripe old age of 25 and so well accomplished. From that vantage point, right? What do you say to people your age who say, when it becomes available, I don't think this is for me? And what would you say to shift that way of thinking?
That's a great question, Dr. Ayers. I feel I've approached this, and the progress I've experienced in this discussion is one that this virus is novel, but vaccines are not novel. The science of vaccines are not novel. Neither is infectious disease. And part of being able to recognize what part I, as an individual, as a young person whose health might be a little more versatile, play in either the spreading or prevention of the spread of this virus goes hand in glove with me committing to what I can do to keep the people around me safe. I know as a fact, my health is not the one that would have ended up in the emergency room. But that's not to say that people I love, family members, people very close to me who I've hurt because they've now been lost, were not in 48 hours infected and died. And knowing that so much of the information so early changed so fast, I think now the important thing is that we're able to sort and steer back to the known part of preventing the spread of this virus and of ending this pandemic. So there is a place for all of us in bringing our world back to our control, and that starts with what we can do rather than what we're unwilling to do.
Right, absolutely. That?
Yeah, I just want to add something because I think it's come up a few times, and I just want to highlight that when we first got the vaccines, everybody talked about how it protects the person, right? And we all say, okay, great, I'm not going to get sick, I'm not going to end up in the hospital, I'm not going to die, and that's obviously wonderful for everybody. But I think we're getting more and more information about how the vaccine is preventing transmission too. And that's a bigger message, and I think it should be more of an incentive because, you know, as Joash mentioned, right, he's young and healthy, he'll be fine probably. But but he wants to protect, you know, other family members or people he may encounter that probably won't respond to the vaccine. And I think that can't be understated, that we're getting that information and that these vaccines are proving to be just like most of our other vaccines, that not only do they protect the person, but they protect everybody else. It's truly public health.
Absolutely. Livia, do you have anything to add to that?
Yeah, I mean, I think, you know, from our experience in the emergency department, it's just so important to think about the transmission and how the life cycle of this virus and how it really thrives. It's not so much about any one individual becoming infected, because at the end of the day, that individual may be okay. But because of how quickly it can be transmitted and how easily, you know, any individual that person comes in contact with can be really at risk. So we see in the emergency department, and we're still seeing in the emergency department, a fair number of COVID patients every single day. And, you know, again, a lot of them are not so sick that they need to be hospitalized. But when they go back out into the community, who are they coming in contact with? Obviously, we give them instructions as to, you know, be strict mask wearers, isolate in one room in their home. But the reality is, before they found out, how many people did they come in contact with while they were still, they still had the ability to transmit. So the more that we're able to cut off that chain of events, and this is what the vaccine is allowing us to do, that's what we need. We need to put a short circuit in this chain. So.
Absolutely. We're going to come back to that thought a little bit, especially if we talk. I'm going to ask questions a little bit later about the variants and the relationship of variants to vaccination. Okay, but I want to go to Seth right now, because Seth, I want to pose a question to you as living, you know, roots in the city of Newburgh, which I think you shared with me has. What was the statistic about Newburgh in New York State?
Well, right now, according to the New York Times and CDC data, we're at extremely high risk area of New York State. I think some of the highest rates of infection in, you know, the state are definitely in the city of Newburgh right now.
Yep. And so now, you know, we've all just gone through and given very compelling reasons, right, about why vaccination is important, and we should all be on a journey to becoming vaccinated. What are some of the barriers, though, that you're hearing out in the community? What are some of the reasons? What are some of the drivers for why people are still hesitant and unsure about the vaccines? Given everything that we just said, there's still something fundamental that's going on in the community. So, Seth, I'm gonna give that one to you.
Thank you for your question. This is an extraordinarily complex issue. I'd say from the very beginning of this pandemic, there has been a torrential downpour of misinformation, quite frankly, that has been spread by many different operatives, the highest levels of our government, powerful media conglomerates, even Russian intelligence officers, and others with nefarious socio-political motives. People who have been traditionally dispossessed are having a very difficult time accepting the claims of certain members of our society in regards to the efficacy and safety of the vaccination, and with good reason. You know, the past year in particular, we've seen the continued perpetuation of campaigns which have basically denied the basic human rights enshrined in our Constitution, and the Universal Declaration of Human Rights by the UN to members of the LGBTQI community, Asian, Black, Indigenous communities, undocumented immigrant communities. I mean, we've seen very public disputes on television and on media platforms between the highest levels of government administration and scientists and members of the CDC played out right in front of us for all to see. People don't know who to trust. I find that people are more apt to be prepared to receive the vaccination once they know that people that they know face to face and contact and communicate with on a personal human level. Once they see those folks start getting vaccinated, they feel more confident in its safety and efficacy. But until that happens, you know, I find that a lot of people are very, very afraid and confused. There's a lot of information and misinformation out there, and people just are having a very difficult time ascertaining fact from fiction.
So then, what do we do for that, right? What are some real, actionable, tangible things that we think may have an impact? And I want to turn that one over to Joash, because I think that, and then Ozzy afterwards, because I think that, you guys really have your fingers on the pulse of what's happening in the community.
Thank you for that, Dr. Ayers. Building on the back of what Seth just said, I feel is 100% correct. Very early on, when this virus was made known to the world, our highest levels of government made an early decision to allow this to run rampant in our communities. And there were other agents involved in this to disinform us and dispossess us of the knowledge we needed to be armed with, that this is airborne, that this could spread, and that the lethality might be different for someone with pre-existing conditions. And then in the absence and the void of that knowledge, the consequence of this virus, while there were so many unknowns, became the self-fulfilling prophecy that we just won't be able to get a grip of it. So do whatever you're gonna do. And now I think we're in the opportunity, now that we know a lot more than we did last year, we don't have to discuss everything we don't know. We actually have a solid enough foundation to have the entire vaccine readiness conversation in terms of forecasting what we do know, that people reading articles about side effects of the vaccine are not actually side effects, but the immunoresponse working as it's designed to do that. And simply being able to extend our horizon from a needle going in your arm to 4 weeks out to 6 weeks out of what to expect and what's going to happen to your body. And even understanding that with vaccines, it's not to say that no one will ever get this virus who's gotten the vaccine. It's to say that instead of it tearing through your internal organs, it won't cause permanent damage or irreparable damage or damage that doctors can't fix. And so these are the types of things that understanding we're not simply hesitant, we're fearful of what we don't know. We can actually bring the members of our community, of our family, and of our friends with us on this journey to what we do know.
And Ozzy and then Tiffany, because I know Tiffany, we've had conversations about this as well, and we'll come to you. So Ozzy, any additional thoughts?
Well, I think we should consider the actionable steps when we are able to provide and share information with our churches, our church congregations, our individual school districts, any of the agencies where we have high-risk populations, just making information available through our child care councils, our food banks and soup kitchens. I think that would be a way if we had folks on hand to share information So, and make them aware that they too can have access to the vaccine, and they need to know where they can actually get it from. I think that's a real big problem. If they don't know where they can get the vaccine, then it's not going to happen. But within our community, and I think we just need to go through places where we have an abundance of people. That would be our church congregations, our schools, our child care and child care councils. So I would, for me, that's where I would start to try to reach out to people to get them information and get them schedules. And I know recently on the news, I heard that sometimes the schedules will only come out 1 week before. So I think we have to do a better job with getting information to people in the community.
I agree. I think that where we've seen a lot of success, and I'm hearing this recurring theme in everybody that's speaking, is the unifier here is the personal connection, right? And the one-on-one conversations that this is taking. I know I was actually reading an article earlier today about an organization that's had major success with getting 20,000 people vaccinated by community collaborations, and also just simply picking up the phone and calling people and talking to them and discussing with them. And Tiffany, I know that you've done a lot of that in your spare time. And if you could speak to what your experience has been in some of the tools that you've used in your conversations with people.
Sure. Actually, as of this evening, I have now scheduled over 40 vaccine appointments for people. It started off with trying to get my parents' vaccine appointments. I found it very difficult to navigate the website, and I'm, fairly young, so I can't imagine how it would be for our elderly population. So once I managed to get them appointments, I started getting appointments for coworkers and friends and families. I put it out there on Facebook if anyone needed appointments, and really my intention was for anybody that's eligible, particularly the elderly population, my friends' parents. If they had trouble navigating, I wanted to help. So I was able to schedule a lot of appointments, and then a friend of mine who's a Mexican American, she had reached out to me asking for assistance with her family and her coworkers, getting them appointments. And after she had asked me for several people, she then wanted an appointment for herself. She had said that she was iffy about it. She wasn't sure about new things, and she felt that the vaccine was rushed. But seeing members of her own community eager to get this vaccine, and seeing how I was able to help her facilitate for them, I think that gave her the confidence and the trust to know that, people of her community are going to get this vaccine. She was ready then to get it for herself.
That's amazing. It's one of the other barriers that I've come across just recently with a coworker and a colleague around the vaccine was really saying that, oh, well, I want this vaccine and not that vaccine, so I'm going to wait until I can get the one that I want. And I'm going to kick this question to Drs. Cruzet and Santiago here. And first of all, if Dr. Cruzet, if you could speak to the vaccines that are currently available in the United States and the differences between them, sort of, I guess, biologically, but also to whether there's actually really a difference in the effectiveness of the vaccine.
Yeah, so there are three, as most people probably are aware at this point, three vaccines that have been authorized for emergency use in the US. Two of them are what are called mRNA vaccines, and these are Pfizer and Moderna. And then the other one is Johnson & Johnson, which is an adenovirus DNA vaccine. They actually work relatively similarly in that there's little pieces of genetic material, like a little tiny little snippet of it, that has the code for a special protein from the virus. The protein on the virus that allows it to stick to our cells and really sort of get inside of us and make us sick. And once you get the vaccine and that little code, the cells in your body sort of use your little protein making machines to make that protein. And then that protein is in your body, and then your immune system recognizes it and says, "Oh, this is not something I've seen before." And so it makes antibodies and other defenses against it. Which is typically how vaccines work. Those first few steps are what are sort of new. Now I say new because these are, for the mRNA vaccines, we don't have any other human vaccines that have been made this way previously, but the technology is actually not new. They've been working on it for a couple of decades. And similarly for the Johnson & Johnson vaccine, which is an adenovirus DNA vaccine, which is slight differences that I probably won't bore you guys with, but I could read about for days. They do have one vaccine that has been using the same technology, which was a vaccine against Ebola. So again, it's a technology that's been studied for decades. And now with all of the resources that were provided in the context of a pandemic, they were able to develop these as human vaccines. And lucky for us, because it turns out that they work really, really well. So you've probably heard that for the Mrna and the Pfizer vaccines, the mRNA vaccines, the prevention of symptomatic illness, meaning having any symptoms when you get the virus, you're about 94 or 95% protected. And for the Johnson & Johnson, to have the protection against any symptomatic illness is somewhere in the high 60s, but in the US participants, it was about 72%. And so people see that and they're like, "Oh, I want Pfizer and Moderna," right? And so, but ultimately, when you look at the data and the outcomes of severe disease, so did they need oxygen? Did they need to go to the hospital? Did patients die? Every single one of the vaccines prevented those 100%. So 0 people who got the vaccines ended up in the hospital or died in the studies. Whereas people who didn't get the vaccine, unfortunately, had some of those outcomes. So they are all equally effective at preventing the things that we really care about, which are preventing hospitalizations and death. So this rarely happens in medicine, that we have things that are little even close to 100% effective, but to have something that's 100% effective at preventing these bad outcomes is amazing. And we're really lucky.
Thank you. And Dr. Santiago, could you speak to what should people expect after they get the vaccine, the first dose or the second dose, as far as side effects? What should they expect? And are you seeing a lot of people in the ED coming back with adverse events after getting the vaccine, or prolonged side effects or anything like that?
The side effects of the vaccine, other than, of course, a little pain where you get your shot, which is expected with any shot, may last a day or two, are really the effects, as Joash said before. It's actually what the vaccine was designed to do. So the vaccine turns on your immune system starts to rev up. And part of that is you get a little fatigued, and that may last for a day or so. You may feel a little run down, a little achy, sometimes feverish with a low-grade fever, not usually a high fever. And that's about it. That's really what's been described. But this is what it's designed to do. And frankly, I'm not seeing patients in the emergency department coming in with complaints of having side effects from the vaccine. What I am still seeing, as I mentioned before, is still a lot of patients with COVID And still, unfortunately, patients who at all ages are having to be hospitalized and are having to go on oxygen and in some cases on ventilators. So again, whatever we could do with this vaccine, you know, putting up with a day and a half of soreness and tiredness is so worth it when you consider that alternative of potentially ending up in the hospital or worse. You know, 500,000 people have died from this disease. This is no joke. So I think, you know, weighing the risks and benefits, it's a pretty clear, pretty clear pro on the vaccine front for sure.
Yep. I think that everybody on this panel will agree with that. So we talked about, you know, how the vaccine works and what to expect from your body after you've gotten vaccinated. I like to spend a little bit of time on what it doesn't do, right? And again, I'm gonna kick this one over to Dr. Cruzet and Dr. Santiago. Please chime in. But you know, one of the statistics that I found really shocking was that there's a lot of hesitancy with young women of childbearing age. And I even found out recently that some of our own nurses in the hospital are reluctant to get the vaccine because of concerns about impact on fertility. So as we talk about things that the vaccines do, protect you, give you immunity, you'll have some side effects, that's what's supposed to happen. It means the vaccine's working. I want to talk about what it doesn't do, and particularly around young women, fertility, and pregnancy. So I'll get back to you, Dr. Cruzet.
Yeah, so there's been a lot of and I get that question a lot, actually, from young women and concerned about fertility issues and will they be able to conceive if they get the vaccine. Unfortunately, that's misinformation that has been spread widely, and of course it's a sensitive subject, right? Women don't want to feel like they're going to do something that's going to harm their child or not be able to have a child. It's a huge issue, and so it's really unfortunate that the misinformation has been spread, but it's not true. So there's no reason to think, based on the way the vaccines work, that they would have any impact on fertility. And not only that, there were women who were in the trial. Most trials exclude pregnant women, but there were women who were not pregnant and subsequently got pregnant after they had been part of the trial. So, you know, obviously shows that it didn't impact their fertility. So I do, you know, just try to reassure the women who ask me that question that there's no reason, you know, there's no scientific basis for that statement, for that concern.
And I would also add that, you know, being pregnant and getting COVID is not a good scene, right? So that puts you at higher risk for complications from COVID, like blood clots and, you know, exposing the unborn child also to COVID. So I think, you know, again, risk benefit. What we know about vaccines is vaccines don't, you know, the mechanism of vaccines don't impact fertility, don't impact, you know, our ability to have healthy children. But COVID certainly does. So I think that's the thing to keep in mind.
And
I would agree. There's also been a study, I was actually reading an article today where there's a case report actually of a woman who gave birth to a baby. She had gotten vaccinated, I think a few weeks before she delivered. And the baby was born with antibodies against COVID. So if anything, you're protecting your baby, right? This would suggest. So I think that's you know, a big take-home point. So John, I don't know if we have any questions coming in from outside.
Well, we do have one question that's related to what you just said. It's from someone who from New York Midwives who talks about her pregnant patients who have hesitancy. They seem to be choosing to vaccinate postpartum. Now there's a case report, which you just talked about, being born with antibodies after the mother was vaccinated during pregnancy. This benefit of conferring immunity to the unborn child is a well-known effect of other vaccines given during pregnancy. And she just wants to know if there are any talking points that you can provide her with. So, perhaps after this we can connect you and, you can provide her with some talking points.
Yeah, and I think the other thing to add is that, the concern of pregnant women is the vaccine getting to the baby. Is it crossing the placenta? And the data show that it doesn't. So the vaccine is not affecting the baby. But the good part is the antibodies that the mom is making are getting to the baby. And so, you're getting sort of the best of both worlds.
So, Ozzy, I want to kick a question to you about, we're talking about pregnant women and children, and I know that one of the things that you're passionate about is getting kids back to school, right? And if you could speak to your observations on the impact that this pandemic has had on families, on children who've had their life routines upended for the last year. I think it would be really impactful for the audience to hear this.
Okay. Well, I live right in the city of Poughkeepsie. And because I try to keep a regular routine, I continue to walk at lunchtime. And within our district, some of our kids are in school, some of them are not. But what I see is that sometimes our children are walking on the street. They are unsupervised, and because they're not in the school because of COVID, I just don't believe they're getting the stimulation that they need to be with other people. The socialization is not there. I think they are not getting the academics that they should be getting. And since COVID started last March, I think for our children in the city of Poughkeepsie, Black and Brown, they may be behind maybe 2 years already because they are not getting the in-class learning that we would like for them to get. In addition to that, I'm really concerned also about safety and also about food insecurity. In the city of Poughkeepsie, when our children were in school, everyone was eligible for a free and reduced lunch, and everyone received that. So because they're not in school, some of the kids, I wonder how many of our children are going hungry. What's happening to them what's actually happening to them if they are not in school? So I know for myself, I would like for all of us to get back to normal, and certainly if our teachers are willing to get back into the classroom, it would be a great benefit for our children. And I just hope, I wish Dr. Rosser was on this, because I would like to know personally, what are we doing to get our teachers vaccinated? Because they are frontline and they provide also that safety net that I would like to see for our children. So if Nuvance has something that they can offer our staff in the city of Poughkeepsie, it would be really great to see our kids, because I know for many of our children, that's where they got their lunches, that's where they felt safe, and certainly when it comes to socialization, and that's all part of being mentally healthy as well as physically healthy. So if we were able to do that, it would be great for our kids.
And Tiffany, I know that you started this off by saying that you have a 6-year-old daughter. How has that been? And have you noticed any impact on her over this last year?
Yeah, so for me as an essential worker, my routine really didn't change much. I was still going to work, getting up every morning, getting dressed, bringing her to my parents. But when she was it's at the end of kindergarten when the schools closed. So she's just learning to read. She was doing great with her reading. And then the schools closed. And over the summer, seeing her go back to school, for first grade, I really noticed how much her reading had declined. And so that became a priority for me, getting her back into that. She's pretty young, so she's really resilient. I haven't seen some of the more severe mental health effects that have happened to our older kids or teenagers. So she's been really resilient, but definitely her reading suffered. And I know within the Beacon City School District, the superintendent had made sure that every kid was fed. He contacted all the families. The teachers were outside with food and free groceries twice a week, but enough groceries to last families for a week, so that people could drive up and have the food put in the trunk of their car, or they could just walk up and pick it up. And then he extended that to the entire city of Beacon. Anybody that needed food could come to the school and pick up groceries, no questions asked. So I thought that was really great that he was able to do that. I know it's a much smaller school district than Poughkeepsie, but that was really helpful to the community. But yeah, my daughter, her reading did suffer, but she's getting back on track now, so that's good. Yeah,
that's good. That's good. So we in the time that we have remaining, I do want to touch on a question of what some knowledge to impart onto the audience, right? So one of the goals here is to have these conversations, but also we want to disseminate this information so that, in hearing this, we're creating ambassadors among the people in the communities, right? And so if I'm someone who's listening to this tonight, and I've decided that I'm ready to get the vaccine, or maybe I'm already vaccinated, but I know that there are conversations to be had with people in my family, people in my church, in my community or around me, people I work with. I'd like to go to the panel. What are some tools, some pearls, right, that we can offer to people and how to have those conversations? And I'm going to start with Joash.
Dr. Ayers, I think that's a phenomenal transition, because ultimately I feel hesitancy lives in an inappropriate frame. The advancements of modern technology are such that in 3 seconds, a signal can be shot thousands of miles into space and thousands of miles back down to Earth to connect one person on one cell phone to another person on another side of the world or right next to them in instants. And so how is it that we could have not only the best and the brightest, but all of the world's minds working to one end, and we couldn't expect that in 1 year we could create a solution to the challenge that plagued so many of us? I think, to Seth's point, that what we saw previously and what we know previously is the failure or the commerce of pandemics and epidemics. We know HIV could have been resolved earlier, that the same type of vaccination against diseases that come up and generate and mutate and adapt against everything we know can be resolved when we put all of our effort to it. And what the vaccine did in this past year is revolutionize the way we understand what's possible in 1 year's time. All of science came together to resolve a challenge that plagued all of the world's population. And now we have 500,000 people in the United States, our neighbors, our friends, our family, our grandparents, our children, our siblings, who remind us of why it's necessary to work together on things this big, on things that aren't just personal. I have 6 siblings, and one of the things my sister shoeboxed this gospel is that it's not about you. sometimes, even when you feel it's personal, it may not just be about you right now. And when we're talking about the vaccine, you might not want to take it, then you don't have to take it. But what we can't do is we can't stand in the way of the information coming. If you have your doubt, it's okay to have your doubt, but it's not okay to say that all of the medical professionals, all of the researchers, all of the science, all of the development that was brought into alignment to resolve this challenge that was plaguing every nation on earth, every people on earth, is illegitimate because I don't know something. And so in that, we can have our doubt, and then maybe we can sit with that doubt and ask somebody next to us rather than say what we don't know.
Very good. Seth, thoughts?
Yeah, that was very powerful, Joash. I have to echo that. This virus, this pandemic is affecting us all on a mental and spiritual level. I think that the problem with this pandemic that we're experiencing right now is a problem of consciousness. It's a problem of compassion and a lack thereof. We're seeing people are infected because they're not thinking about the other. There's in modern society, we are always, we're so asynchronous. We're on our phones. It's easy to connect with people on so many different levels. But we're living in silos at the same time. And these silos that we're living in, although, we're connecting with one another, we're not truly being present and thinking about the other. I think that to receive the vaccination is basically to perform an act of compassion and empathy and care for the other. Same thing with wearing a mask. When you wear a mask, you're not only protecting yourself, but you're protecting everyone around you. By having access and knowing that the vaccination does protect you, by not getting it, you're sort of saying that, you're sort of saying that you don't really care about the other person. And, I find that to be very problematic. And, I think that's pretty much emblematic of this fractured society that we're living in. We can't talk politics. We can't relate to one another on personal levels anymore. And I think that by the fact that we're not choosing to be vaccinated, we're just basically alienating one another and putting one another in danger.
That's very powerful. Dr. Santiago, any thoughts about, tools to add to your toolkit for having these tough conversations with people?
Yeah, I go back to, Joash said something, we don't know what we don't know, but we know what we know, right? And true, these 3 vaccines are new. They're under an emergency use authorization. We don't know a lot about them. That's true. But we also know what COVID is and does. So I think that, kind of fear is this problematic emotion in a lot of ways, because it's based not on reality, but on what could be. But we also have to, at the end of the day, what we need to focus on is what is danger, not what is fear. What is the actual danger? And the actual danger is real. And I see it, unfortunately, every day in the ED. My husband and I are both doctors. We're both frontline workers. And through this whole pandemic, we've been seeing patients with COVID. And we had lived our lives not really thinking about our own vulnerability, but through this pandemic, we suddenly realized we had to make a will and think about that seriously. And the reason was that we were seeing the effects. So again, I think rather than thinking about what we don't know about something, if we focus on what we do know, then I think we make a better decision.
Agreed. Agreed. So we're coming up at the end of our hour together, and when we did this earlier today, I had asked the question of what is the thing that you're looking most forward to. I actually want to pose a different question as we close out tonight. What would you say is one way that this pandemic has changed you for the better? And we'll start with Dr. Kuzak.
I was going to have time to think about this. How has it changed me for the better? Well, I guess I would say I've had the opportunity to work with a lot of people that I wouldn't have gotten a chance to work with and really closely with, which has made me grow as, more than anything, I think, a person, and having conversations like this, but about everything, but also professionally, and being able to convey ideas and convey the importance of any number of things in the medical world, where we get very sort of bogged down in medicine, as doctors and nurses, and we can sort of form our own little groups and be able to talk in our acronyms and such. But I think it's been quite a journey to learn how to spread that information in a way that's digestible and relevant to others. So I think that's something I'm thankful for.
Awesome. Tiffany?
I like to think that this pandemic, I hope, has made me a better role model for my daughter, in terms of showing her resilience and showing her that it's okay to hold space, to mourn the loss of others, of strangers, and to honor those lives that are lost in the memories. But you keep going, you keep moving forward, you keep getting back up.
Amazing. Ozzy?
I am learning to be more engaged with my family and my friends, although my family is long distance. So I'm learning to do a lot more FaceTime or Skype with them so that we can see each other until we are able to visit each other. And it always keeps me thinking about others. And I will always continue to think about family and friends, but until we get everyone vaccinated, I keep a supply of masks, sanitizers, and handouts in the trunk of my car, so that I can always share with people the information that they need to be safe until they decide that they want to be vaccinated.
Great. Joash?
I got this from an incredible person. His name is Christopher Wesley, and he says, I made the wake-up list. Every day for the past year, tens of thousands of people around this world didn't. Mm-hmm. Or they didn't make tomorrow's wake-up list. and being able to approach the day grateful that the breath we have in our body and that this virus targets the lungs, that we can feel the breath coming and going in our lungs, and it's not a belabored breath. We can be grateful for what we have rather than what we don't have in this moment. And the first thing is that we woke up means we still got life to live.
Amen.
Beth?
Yeah, to echo that, you know, it was really scary getting up in the morning and putting my clothes on and going out the door and not knowing, you know, if I would come back to my loved ones healthy. It was really traumatic to, you know, be in the presence of people who were actively dying in the emergency department and couldn't be surrounded by the people that they loved at that time. This is a very lonely virus. I believe that this pandemic has really taught me to be grateful for every aspect of my life, no matter how seemingly insignificant it may have seemed prior to this virus, this pandemic, and how important human connection is.
Absolutely. Olivia?
Yeah, kind of related to those last two thoughts, but I think I got better about choosing my battles and, you know, not overreacting to everything. I was 6 months into a new job as a medical director when this all hit, and I figured I better stay calm and keep people with their chin up. So I can't get all, you know, upset about every little thing. I have to pick my battles, and I had to apply that at work. I had to apply it at home, because again, this has been a rough go for everybody, not just, you know, at work, but also at home, because our families are also struggling with this. So I think that's a good lesson to take forward.
John?
Wow, just listening to all of you is just kind of making me very emotional. But I will say that for me, the biggest thing I've learned is to just be present. You know, my life before this pandemic was a world of distraction and constant phone calls and this and that and this. And, you know, I think crisis brings out the best in people. And I've seen like my colleagues like do like incredible things. And, you know, just sitting on this, you know, on this Zoom, you know, making eye contact with each of you and taking that moment to breathe in, you know, the fresh air when I go out on a walk, and just appreciating those moments with my son. You know, I do believe that that will carry on for the rest of my life, and something that I will, you know, value the journey that we've all made through this experience together. And I look forward to the time when, you know, we can share this experience together and not virtually. So, and Brenda.
All right, I'll close it out. I'll say two things. I'll say one is that this pandemic has made very clear for me what things are most precious to me, and that I will do whatever I have to do to guard those things fiercely, which is why I got vaccinated. Right? I love my children. To not have to live in fear anymore of that I'm going to be the one to bring home this terrible disease to my 11-year-old daughter who has asthma. I'll go to the end for those things that are precious to me. And the second thing that I'll say is that it also made me realize that old question, am I my brother's keeper? I think that this disease has taught us in no uncertain terms, the answer to that question is yes. Mm-hmm. Because we're not safe unless all of us are safe. If there's one person vulnerable, we're all vulnerable.
Mhm.
And that level of interconnectivity, whether desired or not, is undeniable. And so really understanding that, or coming to understand that, having that epiphany over the course of this pandemic is, I would say, has changed me, hopefully for the better, and really being able to accept how connected I am to people I don't even know, which is why I continue to wear my mask. I continue to socially distance. I continue to wash my hands, even though I'm vaccinated. Okay, because someone said earlier about how fractured I think it was you, Seth, about how fractured our societies are. You know, to understand and to accept the fact that it's not about me.
Mm-hmm.
There is no me in a pandemic. I mean, there is, but there really isn't, you know. So to accept that and own that, right? And I think that that's the message I'd like to push out to everyone, is that it's not about you. It really can't be. It's not about me. It's about us collectively all doing those things that are going to keep ourselves, those we love, and even those we don't even know safe, because it's the right thing to do. Continue to wear your mask. Continue to wash your hands. Continue to stay socially distant, all right, until we know that it's safe for everyone, not just for you. Okay? So I want to say thank you. Thank you all so much. Thank you to this wonderful panel. Look forward to doing this again. And I thank you to everyone listening. Good night.
Hi, everyone.
Thank you. Good night, everyone.